Welcome, everyone, to today's webinar, Why Focusing on the Consumer Experience Pays Off for Healthcare Systems. I'm Malia Pavla with Becker's Hospital Review. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'll walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. And with that, I am pleased to welcome today's speaker, Kristen Valdez, who is the founder and CEO of Be Well Connected Health. Kristen, thank you for being here today, and I'll now turn the floor over to you to begin the presentation.
Thank you so much for having me. Be Well Connected Health was founded in 2015 as a healthcare technology company looking to reimagine the healthcare experience for consumers, but from the angle of a B2B lens with employers, payers, health systems, and retail pharmacies all on the Be Well platform today. Today, we're going to cover a large number of learning objectives, including moving beyond patient journey mapping, making sure that we can look at current healthcare architectures from a technology perspective, and why open, secure data architectures are becoming an advantage to health systems in their digital transformation journeys. We're also going to be looking at how to redesign accessing care and providing consumers choice, and how that impacts both the health system as well as the consumer experience and can drive increased loyalty, and how to deliver a digital transformation roadmap with effective governance that actually aligns across the organization, because we all know that digital transformation is as much of a cultural change as it is a transformational technology change. So we're going to move pretty quickly. So why is healthcare so difficult for consumers today? Well, that's simple. Healthcare was created to try to fit consumers into other core systems designed for different purposes, versus the other way around. So consumers have portals and passwords and logins for every doctor, hospital, lab, radiologist, their employer-sponsored health and wellness programs, their HSAs, their FSAs, their insurance carriers, and what is now more than 300,000 digital health applications that sit on the cloud. To make matters worse, healthcare is consumed as a family unit in this country, and that means that we are often caregiving to not only our children, sometimes our spouses, and now more often our parents, who are living generationally 25 years longer than the generation prior, and often living independently. There typically is one healthcare CEO in every family that manages healthcare. 86% of the time, that's a female. And that means that we can't expect to have the chaos of all the different logins and passwords and siloed touch points of a consumer experience to be given to that healthcare CEO times the number of people that they caregive to in their lives. But it is important not only to involve that health circle, but making sure that there is appropriate security, sharing, and permissions, and that alerts can come to people, such as myself, who caregives to a parent who does not live with me with multiple chronic diseases. I am the human that needs to see that dad hasn't picked up his meds on time, or that it's time for that follow-up cardiology visit. So creating and designing systems and experiences for the whole family unit is incredibly important to meet a consumer's needs. But one of the things that we've learned by working across employers, payers, health systems, and retail pharmacies is that everyone has a slightly different view of the human, and they're different. And sometimes data is old, and sometimes it's incomplete. Sometimes there's conflicting information. But each person that is caring for an individual in their healthcare journey has a totally different slice of the pie and understanding of that human, which makes it very hard to get today's technology out to consumers in a meaningful way. But one thing we know is that the time is now for digital transformation, and there are 4 really aggressive market forces that are causing that. One is consumerism, and the fact that consumers from a regulatory perspective are now given more power than they've ever had before in terms of access and collection of their data. There's new competition emerging as a result of this, trying to drive towards the convenience that consumers are now demanding as a result of 2 years of a global pandemic, and recognizing for the first time that healthcare can be delivered in a digital format, in telephonic format, and in the home, and making sure that we have a digital first experience like we have with every other aspect of our lives. From a regulatory perspective, there's some very key regulations, but there are more coming. And CMS has been very clear in that they are trying to create a shoppable healthcare consumer. Most folks understand information blocking and interoperability rules, but little or known rules like the anti-kickback safe harbors now allow for digital experiences to involve gamification and rewards monetarily equivalent for consumers to align with their care plans. And that means loyalty programs that we see and are applicable to our grocery shopping, to our airline travel, and many other aspects of our care can now finally be applied to healthcare. There are more transparency rules coming, whether it is price transparency, prior authorization, real-time pharmacy benefit check, and the government is showing no signs of slowing down. But competition is also not who it used to be. For health systems, we were always worried about the doctor across the street or the system across the street. We now have to think about digital entrants. We have to think about pharmacies that are no longer just direct-to-consumer pharmacy transactions, but are now healthcare entities in and of themselves. And making sure that these new entrants and concierge programs are in our backyard, but these companies were born and grown and have made successful through understanding the consumer at a deeply personalized level. The future of healthcare is consumer focused, and companies that we are now competing with absolutely understand that. The challenge is that while consumer conveniences are widely known in terms of what consumers want, they're mostly still not available today, such as holding my place in line at urgent care, offering a same-day appointment, allowing me to self-schedule for appointments for myself or for my family, and controlling the schedule so that it fits conveniently into my life. So introducing the informed, connected health consumer. There's some definitions here, and we're going to go through them pretty quickly, but effectively we're trying to create an environment where consumers have a seat at the table, having all the necessary information and insights to select where and how to navigate their care, being connected at all times for update, moving beyond wellness and lifestyle and management of chronic and into management of chronic conditions and prevention so that we can avoid those chronic conditions in the first place, but personalized to our own data, and making sure that we can give consumers choice. When we think about journey mapping, many systems have patient journey maps and touch points and experiences. But in a successful digital transformation, it's particularly important to not only look at every touch point that the consumer may have with your system, and what they expect to get out of that experience and what they need emotionally, as well as from a technology and data perspective. But it's equally as important to go back and do that journey mapping across what providers need from each one of those touch points as well. In this time of staffing shortages, it is becoming more critically important to automate as many desk jobs and time-saving measures as we can. So understanding the provider's perspective not only achieves better buy-in for what it is they're looking to accomplish with those goals, but also having tangible hard savings, both in their time and in their workflows. But the third layer we recommend going back and doing is what your health system needs out of each one of those touch points. So as you're thinking about your digital transformation, making sure that you are organizing your solutions and your workflows and your journeys so that they not only meet the needs of the patient, but that they meet the needs of the overall objective of the health system and the providers in there. And that helps to create successful digital transformation environments. But it's also important that we move away from the one-size-fits-all of healthcare today. Today, we receive as a population communication such as it's flu season, get your flu shot, or maybe you need to get more sleep or move more from an exercise perspective or be gluten-free, soy-free, or whatever free someone suggests you may be in that moment, but they're not personalized to individuals. So it's important to understand empathy maps and consumer understandings and develop user personas, because you may be trying to get an entire population of people who qualify to get a colorectal cancer screening, but they're not all going to be effective and communicate in the same way. So we need to know what matters most to people. I am a caregiver, and that means that I want to know everything that I'm overdue on in every one of my children's lives, my parents' lives, and everyone else who I caregive for before you start targeting me for something I need to do. But there are also people that are rule followers who simply want to take the direction of their provider. And so messaging needs to come across as coming directly from their provider. While we know it doesn't need to be the provider messaging them, we can do this in a more automated fashion. It is important to target the emotional response and the needs of the individuals that you serve. When we think about that, that allows hyper-personalization. Why is hyper-personalization important? Because for far too long, people could say that doesn't apply to me. It's not applicable to me. I already do that. But by accessing a consumer's information and using that data to communicate back with them in a manner that matters most, you can actually derive different information from a persona perspective and target the populations that you serve down to an N of 1, and we're going to talk about that. The information blocking and interoperability rules allow for consumers for the first time to aggregate all of their healthcare data into a longitudinal view through trusted third-party applications. Applications can also collect data in real time. Surveys such as things like the PHQ-2, being able to look at health risk assessments, behavioral and lifestyle habits, life likelihoods, social determinant information. All of that information combined with clinical information from payers, providers, wearables, sensors can go into personalization engines and literally deliver different types of communications down to an N of 1 by that individual. And it can target them through the omnichannel preference that they choose. Most consumers, and I'm sure it's no surprise to anyone on this call, prefer text messaging, which means that we need to gather consent so that we can gather enough information and consent from the individual to share HIPAA information with a user if they should choose to receive that information in a personalized manner. They're more likely to react to it if we do. Now let's talk a little bit about architectures of data and systems and how we've aligned healthcare delivery systems in the past. One is we are contending with more and different things than we've ever had to contend with in the past. Data is no longer something that comes on an FTP server every 30 days, 45 days delayed. It is now real time, it is streamed, and there is more data that we can access than we've ever had to deal with. It is no longer just what's in the medical record or the insurance claim. We have wearables and sensors for every part of our body. We have 300,000 digital health solutions, each capturing a different piece of information around a consumer's overall health journey. But data can come in terms of being tracked for what did this user do on this website? What did this user do inside of an application? Where in the funnel did they fall off? Did we lose people? Did we keep people? Did we delight people? And we can collect that data in real time and start to make changes in our assumptions based on the collection of that data. And now we have the ability to look at data beyond our own single pane of glass, the services that we provide. And we can gather data historically from an individual even before we see them, where we can see their full longitudinal medical history. We can see all of the insurance claims and how much they've spent. We can see information on social determinants. And we can bring that information in to make sure that we are matching individuals to the right doctor at the right time with the right modality of care and fitting into their everyday busy lives, because we don't all have the opportunity to take off work and get into the doctor. Now we can actually start to treat people in a way that is convenient for them, where they're more likely to follow through. More data than ever has become available, and it is critical to pay attention to this data because data equals personalization, and personalization is what equates to activation. Being able to say, Dr. Smith would like you to come in because it's been 6 months since your last A1C, you're a person living with diabetes, and we need to measure this result. Feel free to drop into your local pharmacy, LabCorp, Quest. Here's an order that can be delivered, and we'll go ahead and set up a telemedicine call after. Let's look at your last A1C trends. Were you headed in the right direction or the wrong direction? Here are some things you can do to control your A1Cs long term. So you can provide education at different types of reading levels. We recommend no greater than 4th grade, given health literacy issues that we have in this country. But being able to showcase a consumer their own data and help them understand why you're making the ask and not making it over their head or too complicated results in more consumers actually complying with the workflows that you are putting forward. So when we think about where we started, we today fit consumers into systems that were not designed to operate around the holistic consumer experience and all of their data. We're now looking at open, secure data architectures. And an open, secure data architecture allows for things like FHIR-native platforms to emerge, where all data moves into the Fast Healthcare Interoperability Resource Standard, and that data can be made accessible through APIs out to partner systems, which we'll talk about in a moment. It is important that open, secure data platform bidirectionally integrate with all of your core systems, like your EMRs, making sure that you have your care management systems integrated. Any other type of system, whether it's a CRM or a billing system, needs to be bidirectionally integrated with, because the consumer is going to expect from a web and a digital experience that when they show up at your door or engage with you in any other one of your systems, that your systems are intelligent enough to know what happened in that web and mobile experience, and that all of the information is shared across modalities. But this also allows you flexibility in the front-end experience that you can deliver to consumers and the partners that you are working with, or even launch new business models, because it shouldn't really matter what partners or systems you plug in or unplug. You want a single pane of glass or launching off point for a consumer to access all their information in one place, but it should be consistent to the consumer, where they never have to create another login and another password, and you should be able to change in order to keep up with the speed of innovation. FHIR has been widely adopted. I personally believe that it is the way healthcare data is going to be transacted across the world, but it is still in its infancy, because there are a lot of different types of data that still need to be standardized through implementation guides on FHIR. There's a lot of work technologically that needs to happen, but you can standardize all kinds of data in endpoints through FHIR and follow multiple different standardized entities that are working on implementation guides to bring more and more data into the standard. What it does, though, is it allows, from a system-centric approach of health system applications, to start to move and migrate through an integration layer into a consumer-centric or person-centric or family-centric approach, where you can actually accomplish all kinds of different things, whether it's identity proofing, consent management and workflows, external connections, data science and processing. It's not just BeWell that talks about open, secure data architecture. Some of our greatest thought leaders in healthcare today are recommending the same, whether it's Ernst & Young or Deloitte, Damo Consulting, BCG. All are talking about how to have a centralized and core data layer that is open and secure, that actually allows for you to apply your data science and your partners into that secure data layer in order to move faster and be more innovative. We do know that over 93% of healthcare organizations have a digital transformation strategy aligned to this, or are in the process of creating one, and that is only accelerating based on what we see in market. So the new consumer health paradigm that EY refers to, where there is participatory healthcare with consumers sitting at the center, you can too deliver your digital transformation strategy centered completely around an individual and their family, where you can add in everything from behavioral and wellness programs to telehealth, digital health, virtual health, asynchronous health, access to all of your services, and offering even more insight and information into what is, approved for prior authorization, what is it going to cost, what insurance and benefits have you utilized, and taking a lot of those phone calls administratively and allowing consumers to self-serve and see those, but also to have a seat at the table in their care, where they can start to understand more about health literacy and how it impacts themselves and their families, where they can make choices that are aligned to evidence-based medicine. These core systems allow for you to API out everything, and this is really important because that speeds integration, whether it's with embedded other systems that you have, portals, other applications you've already developed, or even partnered to deploy. You can provide APIs out to payers for those systems that are at risk and are having to share. HEDIS NCQA just launched a pilot where FHIR-based APIs are now being tested to determine if that's how HEDIS data can now be provided and supported, but also to other business partners as new and different business models emerge, as well as other core systems, analytics platforms, care management platforms. Having those APIs out allow for everyone you need to integrate with to be able to grab data and to do it at a point in time that is necessary for whatever services they are actually performing. What I love about this is it actually changes the way that we can deploy partners and solutions beyond how healthcare has purchased digital health and solution partners in the past, which has been through very lengthy RFIs, RFPs, selection committees that have determined that this is the one partner that we should be working with and deploying to our whole population. Imagine if you went to Amazon and Amazon said, nope, you don't get to choose. You're getting this pink towel for your downstairs bathroom because Amazon has decided that that's the towel that you should receive. And that's the one that you should use. We don't expect this from a consumer perspective in our everyday lives. Why do we expect it from healthcare? Rather than taking everyone through a very lengthy process from a security review perspective, a contracting perspective, an implementation perspective, and then a very lengthy marketing and deployment perspective, only to learn that 3 to 4% of people will actually utilize, is because we are being paternalistic and we're selecting something that we think will work for an entire population. One of the best advantages we have to improve health equity is we have the ability to create and offer choice in all of the different innovative solutions that are out there. And we can create robust, open, double-sided marketplaces where we can allow digital health partners to onboard themselves to our ecosystem, and we can use data science to personally match individuals to solutions they're more likely to engage in, while improving health equity all at the same time. In this case, you can see that here are 4 phenomenal maternity programs that help support moms all the way from pre-pregnancy through pregnancy through postnatal behavioral health. But only one of these companies is designed for Black moms who have very different health outcomes in this country. So if we're selecting only one, we're oftentimes not going to make a selection that meets the needs of part of our population, and we need to think differently about how we can deploy partners and services and allow the populations to select what they're more and most likely to engage in that's going to drive outcomes. And if something's not working for them, wouldn't it be great if they could have the right to be forgotten from that organization or entity, and they can select 2 or 3 more that might be a better fit, therefore engaging and activating in their healthcare more frequently. So let's talk about how redesigning an access to care system can have a profound impact. When you think about consumer shopping for healthcare services, there's a lot of things that are missing. Price transparency. Well, coming next January, you're going to see commercial plans have to offer the equivalent of an EOB to a consumer outside of emergency room charges, where they're going to have the ability to shop based on price. But they do want choice. What is going to work for my life with my family? And what looks most interesting to me that I'm going to find fits into my life, but also meets my needs and that I find engaging? Personalized recommendations, removing friction between stakeholders so that we're not saying, hey, we think that you should participate in this behavioral health program. Oh, but I'm going to drop you into another application where you have to complete yet another form, another login, another password, all with information that you already have about me. So stop making it hard for me as the consumer to participate in all of these programs. Establish a digital identity for me, and then make sure that I can go through and you can pass information through an open API so that that account can simply be created for me. But give me the control and permission to know that only information that I've consented to share is shared, and give me the right to be forgotten. So what today's consumer is looking for that can provide tremendous loyalty to your organization is a couple of key things. One, all of my health data in one place. Give me access not just to your pane of glass, but to a single pane of glass that covers all of my healthcare data and experiences so that I have a holistic longitudinal view of my health record. Give the information wrapped around it that helps me understand it. But use that data to create personalized and timely insights and actions in order to proactively tell me when there's something that I need to do and make it easy for me to do that through navigation of care, whether it's in person, virtual, or digital. Make sure from a loyalty perspective that you're meeting my needs that I experience in other aspects of my life. If you think about the Apple ecosystem, they've done a phenomenal job at driving loyalty. If I have an Apple Watch and a phone and a tablet and a laptop and an Apple TV, Apple doesn't expect that I need to go log in, set up, and register all of those things independently. If I do something on one device, all of my other devices are smart enough to know that happened, and all of these are designed around me. So why would I then go shopping and look for another wearable smart watch or pick up an Android or a Samsung if this is my ecosystem? So driving loyalty, healthcare can do the same. So by giving consumers access and transparency to everything in one place, giving them personalized insights, and anytime they either need care or you're recommending guidance aligned to evidence-based medicine proactively, why would they go somewhere else? Why aren't you the launching off point for their healthcare experience? Not only does this drive proactive revenue into your organization because people will come in for care faster, they will start to close their own gaps in care by making appointments, but also increasing value-based contracts. Here's 200 points for a 2-minute survey, and you can effectively use the PHQ-2 to depression screen your whole population through digital. You can connect them into other continuity of care items. If, let's say, they don't perform well in the 2, we move them to the 9, and we move them immediately into a telehealth or behavioral health encounter in order to complete the 9 or as a follow-up. The goal is that you can actually automate and digitize things, but you can have everything done through one single pane of glass for an individual and their families. Some early systems that have leveraged the ability for consumers to find and match to a doctor in their system have created availability waterfalls. If your doctor's not available to see you for 6 to 7 weeks out, 70% of people will abandon that appointment. But that's what we refer to as leakage. And so if we say, hey, if your doctor can't see you, here's the next available doctor who can, and provide an option. If that doesn't work, here's a same-day e-visit or telehealth visit that you can have today. Would you like us to set you up for that? So if something is not working for the consumer, give them choice with the other services that you provide, but don't expect them to go log into a separate platform and know that you have that service available in order to do that. Connect them through the front end and make it seamless from a consumer perspective, and it will absolutely drive better loyalty to your organization. And let's not forget that when you launch this to the population that you serve, you're naturally building a network effect through the health circle. If I tell my family, my friends, my nurse neighbor, some of my physicians about this, they download, they look at your application publicly available to the populations that you serve, and they say, I want that. I want someone to give me access to all of my health records and information. I want to be able to more easily find a doctor, navigate, and make an appointment, and leave survey information. You're naturally growing your network without spending network or marketing dollars in order to achieve customer cost of acquisition. So by giving consumers something that they've never seen before themselves, you can actually create real stickiness, because consumers are interested in accessing their health record, not because they truly want to understand it, but they want the power to share it with people who can add value into their healthcare journey and into their lives. And that drives loyalty and trust to you as part of your overall digital information goals. If you think about the fact that we can now have consumers proactively close their own gaps in care. We have 2 health systems. I'll give you an example of 2 health systems that each have 400-person call centers. One of them has said, I really don't want to have a 400-person call center because 80% of what that call center does is book appointments. What I really want is I want those nurses to come back due to the staffing shortages into on-site and be able to help us with our staffing shortages. And we want consumers to be able to mobile appointment schedule their own appointments, fill out their pre-visit forms, not do all of that advanced data entry. But also, we have consumers who can now close their own gaps in care, but by giving them choice, they're more likely to comply. So we have another health system who says, I do want a 400-person call center, but I want that 400-person call center to be talking to people who will not engage with me digitally to close gaps in care as I'm moving forward into value-based care and risk-based arrangements. So in this case, you can automate to push notify to people, hi, happy birthday. It's time to schedule that colorectal cancer screening. Now, we don't recommend doing that on a birthday, but in or around the same time coming up is appropriate. But giving choice is important. Would you like to mobile schedule an appointment with your doctor, or can I send you an FDA-approved toilet water test into the home? We can follow up with a telehealth visit when we receive your results. And then you can nudge people in order to do that test because you know when it's delivered and you know when it's received. Digital transformation absolutely enables key value drivers for your business. You want to be the provider of choice. You want to grow your market share and win new business from your competitors. You want to keep people who are already trusting you to take care of their care. You want to win in at-risk models. So as more shift into downside risk, not just upside risk, that you know that you have visibility into the populations that you are serving and that you know what needs they have, and you're communicating with folks effectively in order to close those gaps, and you can see very clearly what's been closed and what hasn't. Obviously, we want to all improve our NPS score and drive our revenues so that we have a seat in the table at the future of healthcare. But the future of healthcare is consumer-focused. Some early results that we've been collecting from health systems who are further along in their journey, they're learning things like don't require everyone to have a portal account and password. Allow people to access our services by being a guest. They're seeing a 17x increase in conversion of people making appointments when you simply don't ask them to give you all their private information before they've decided that they're coming to you for care. Just like we would shop, in an online setting, we want to make sure that we've put something in the basket and we are committed to following through with that purchase before we give up our credit card and address information. The same is true in healthcare. We've seen that by consumers controlling their own appointments and schedules, that you can have consistent 2% no-show and cancellation rates. You have 67, 87% of people that are now closing gaps in care based on communications that you're delivering digitally and not having to pick up the phone to do. Again, saving your most coveted resources, your doctors and your nurses, and making sure that you can maintain satisfaction of the user throughout the entire process. When you think about the 3 key pillars of work that are required in order to launch a successful digital transformation strategy, one is strategy and governance. We all know that digital transformation, hands down, is a cultural change. It is not an IT project plan. If you are treating it as such, you are absolutely going to fail. Digital transformation actually affects the workflows of the organization and touches every single part of how you operate your business today. So it is important that you have a strategy and governance where you have the right team structures, key roles in place, collaborative work streams, and overall transparency to what's being worked on in the organization. If your team is deploying digital and mobile solutions and the rest of the organization doesn't know they exist, it's really hard to get adoption. And people are going to be pushing to different systems and even telephonically. Things that you're trying to accomplish with your objectives and key results may not go so well if you don't have the ability to have an effective strategy, governance, and communication plan. We talked about journey mapping. It's important with those journey maps not just to look at what is expected out of the encounter from the patient, from the provider, from the health system, but also to measure what is the key result that you're expecting out of automation or digitization of each one of those touch points. Is it a pain point today? Is there a very real dollar amount to the bottom line? Are you reducing admin expense? Are you helping to improve, revenues? Are you looking at new patient acquisition? What is the objective and key result? And make sure that you think about how to be agile, which we'll talk about in a moment, because there's absolutely no workflow ever that was created that has not been deployed where there are not learnings that can be delivered in order to measure and adapt. And from a platform perspective, truly think about now what your architecture looks like. There are plenty of organizations that are saying, hey, the EMR is our single source of truth. Everything needs to go into the EMR. And what I would encourage you to think about is that the EMR touches such a small fragment of a consumer's overall health experience, especially your own EMR, that there is more and more data that is coming in like a tidal wave that can be utilized in order to deliver better experiences that drive superior outcomes. And while absolutely there is no replacement to an EMR, they absolutely will always have a place, that there are challenges with trying to fit every single digital health solution bidirectionally into your EMR, as it was not designed in order to provide multiple solutions out to consumers that are outside of the workflows of your core system. So look at open, secure data models, cloud-based APIs, being able to reimagine access to care through your own, digital front door. I'm sure we've all, if I could see your hands, have heard of and are probably already tired of the digital front door. Let me help you understand the difference between digital transformation and a digital front door. A digital front door assumes that a consumer already knows that they need healthcare. They're showing up at your door and they're asking for something. The digital front door is, can you actually service them in a way that meets their need? Can you help them find the right provider? And not just, is there a provider based on a specialty? Many consumers don't know specialties or what kinds of doctors treat the kind of need that they have. So if in your digital front door, you're asking somebody who's looking for an appointment with someone who treats migraines, you can say, oops, that looks like a symptom. Let me throw you over to my chatbot that's going to talk to you about migraines. You're missing the fact that they're looking for a doctor who treats them, and they may not know what kind of doctor to start with. We have lots of people who are searching for baby doctors, as an example, and your system should be smart enough to know that what they need is a list of pediatricians. And so thinking about how data science can actually start to deploy real value is in the simplicity of starting to gather and train models based on how people search for care in your own environment, but then matching them. Will this doctor text message me? Do they offer same-day appointments? What languages do they speak? Helping to gather more and different information to match people to providers that they're more likely to find success with also can help to drive loyalty. So thinking about moving forward from a platform perspective into different kinds of ways of reimagining things that are done today, but thinking about them from a consumer mindset. In the Agile mindset, and this is very hard for healthcare, which is operated in Waterfall in the 30 years that I've been in it. And that's because we expect to buy something that is complete and off the shelf if we partner, or we expect to build it and we have an MVP that we don't launch until it is complete. But the reality is that the faster you get something to market and you start utilizing it, you can learn from it and you can learn from the data. So measure everything. Understand where is your baseline and where is it you're trying to go. Does your new digital transformation workflow actually accomplish that goal? If it doesn't accomplish the hypothesis or the goal that you think, is it because people are falling out of your workflow and you designed it wrong? Maybe instead of asking someone who is looking for an appointment to create an account with you first, if you move that to the end after they've decided to book the appointment, will more people come through? The answer to that is a yes. But at the same time, you need to iterate very creatively. And what are the results that you can drive? How do you make them transparent to all levels of your organization so that you can have a successful digital transformation that continues to get funded because everyone involved sees the value out of it? But it is important not to commit to something that is going to be a definitive, because one thing we know about healthcare consumers is their mindsets are shifting, and they're shifting faster than they've ever shifted before. We've provided a framework that allows for speed, scale, quality, and efficiency, and to drive value. So setting the mission and vision of the organization, the strategic focus, what are the prioritized themes? Do you create key performance indicators and objectives and key results for everything that you do prioritize? And then how do you run very quickly and prioritize a very healthy backlog, because there is always going to be more work than people to do it. So how you prioritize that to accomplish the health system's overall objectives are really important, but making sure that you're balancing in and not creating more pain points for the people that are involved in the workflows when people do show up in person. So we recommend your company mission and goals and values. Those are just infinitely deployed across your organization. But annually, you look at your strategic imperatives and you make investments in the key performance improvements that you're looking to accomplish. Quarterly, looking at your roadmap and your objectives and key results, as well as your backlogs that happen every month as you're running into development sprints where people have the ability to start showing progress on different objectives and key results and where they are to deployment, and having a very effective strategy to roll that out across the organization. But if you leave here with nothing other than one message, is that the keys to a successful digital transformation project are: one, embrace digital first. Consumers expect digital and web. This means that you have very complicated decisions that you need to make. When you think about the cost of trying to maintain parity between your website, your EMR patient portal, and a mobile and digital experience, you do have to invest the time to make sure that you have the exact same education and skills or available services that are available on all, deployed on all, because what consumers do expect is continuity, and they expect you to know them and to work with them in a personalized manner. So if one is significantly more advanced than the other, you're going to have a drop-off in services and you're going to cause consumer confusion. But prioritize data, because data actually leads to activation and loyalty, and you can learn from that data. And I don't just mean the medical record, all data. How do people interact with you? What steps are they taking? What do they like? What do they not like? What are their preferences? How do they want to be communicated with? And don't be afraid to modify workflows in order to drive data to help not only gather it, manage it, understand it, and then be ready to take action on it. But adopt a consumer mindset. We are all consumers of healthcare. Many of us are also caregivers or care partners from a healthcare perspective, and it's amazing what you can learn by talking to the people who come through your front doors around their experiences and their pain points. Understanding what they expect out of each one of those experiences or touch points with you helps you to really refine and to mature your consumer mindset. We are Be Well. We are the leading digital health transformation platform in market today. We are really looking forward to, for those of you who would like to gather more information around governance or journey mapping or how to set an appropriate strategy or to advance your digital transformation capabilities. We would be open to any conversation or with you. I've provided my contact information if you'd like to reach out. Feel free to connect with us through our website, Twitter, or LinkedIn, and we will go ahead and open up the Q&A session of the presentation.
Awesome. Thank you, Kristen, for a great presentation today. We will now begin today's question and answer session. As a reminder to the audience, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. Let's get started with the first question. So the first question I have for you today is, audience is saying, we typically do software consulting and services as separate relationships and even separate contracts. How should we think about services, technology, and consulting and those contracted relationships? We think of them separately or bundle where possible.
Yeah, it's a great question. So there are many organizations that choose to work with their thought leader partners and consultants in order to do appropriate planning, right? That's the way that healthcare has historically done things, is that we create an objective, a plan, we fund it, and then we work really hard to outline the entire thing from end to end. That is the waterfall mentality that we talked about previously. From an agile perspective, it is important that you start to operate as quickly as you can, because your competition certainly is. And the way that you can do that is you can run certain components in parallel. So we talked about being able to run in parallel your governance strategy and how you communicate across the organization, make decisions and make prioritization. But you already have certain pain points that you know you want to target. You have baselines and benchmarks of things you want to improve. So you can start with those priorities while you're working on building out the infrastructure of how you're going to operate moving forward with your digital transformation, because pretty soon it won't be digital transformation. It will just be how healthcare is deployed. But at the same time, you can be working through continuous journey mapping for all of your touch points and partners and business models in tandem. Even if you have patient journey mapping, you could be going back and doing the provider touch points and research as well as the health system touch points and research at the same time, while still setting up all of the architecture at the same time that will allow you to be ready so that when those prioritized roadmap items come in, you already have the architectural framework in place to be able to run very quickly. If your organization needs to experience digital transformation momentum, it is incredibly important to be able to show outcomes and actions and results, and that there is movement in real time all the time. So if you spend a year planning, sometimes the momentum for your project can die because the people in the organization were expecting to see something, and then they think it's just the next shiny object. So if you can run in an agile format where you are delivering expectations and communicating frequently on the things that you're doing, and because you're measuring objectives and key results, the key results will speak for themselves in terms of whether or not your initiatives are having any impact. So we encourage doing those together.
Awesome. Thanks so much, Kristen. Some really great points and tips, and the data will really speak for itself, as you said. So the next question I have for you is, has any health system documented improved outcomes driven by digital transformation?
Oh, absolutely. There are a number of them that we've seen. And as you know, digital transformation, there are people in multiple different stages. Some people are just planning. Some are actively, kind of off to the races, and some have become quite mature, where they already have all of their physicians on open and mobile appointment scheduling. They have integrated core digital health solutions. They have machine learning and data science running to advance some of their existing processes. Measurement starts with everything from, NPS scores and satisfaction scores to, do the people on my digital platform comparatively to not have more gap in care closures? Are they making their own appointment? Are my no-show and cancellation rates better with people who are mobile scheduling versus those who are picking up the phone to call? Are they more prepared for their appointments? There's a number of different metrics, everything from you can look at your existing baseline call center metrics. What are the base reasons that people are picking up the phone to call? With your digital transformation, if you have self-service, you're promoting to consumers that they have that self-service, then you can actually look at and measure the differences between why people are calling and see some efficiencies that are being gained. So it really depends on the objective of the system. I will say none of our health systems have exactly the same priorities. Some are focused on being population health organizations, doing capitated contracting with the employers in their community, and being the place known for preventative services. We have others that are working on attribution of lives for and improving health equity through the ACO REACH and direct contracting models. And we have others that simply are in a very competitive environment trying to be the system of choice and to increase loyalty so that they are the place that patients go when they have a preferred health need. So depending on the needs of your organization, and we do come on site in many cases and help run programs to help your leadership team prioritize what they want out of a successful digital transformation, that allows us to understand the objectives of the organization, and then we can turn the priorities on the roadmap into key results that can be measured pretty immediately right out of the gate.
Awesome. Thanks, Kristen. Some really good examples of how health systems you're working at are looking at improved outcomes and really seeing that. So the next question I have for you is, how is digital and cybersecurity insured?
So this is a very big item, but when you think about, HITRUST is a certification from a security perspective that has become the gold standard for digital health entities and organizations. It's, one of those things where you have to prove, compliance, et cetera. So BeWell is actually a hybrid organization, which means that we operate both inside of a BAA under HIPAA and outside of HIPAA under the patient right of access. There are very few hybrid organizations in the country, but they are designed so that consumers have their patient right of access and can share and consent data with whomever they choose, and then we still are obligated, under HIPAA. So just like you would look at a partner for digital and cyber, you would look at, what are the practices and the infrastructure and architectures of that organization? What do they have in terms of best practice for cyber and security? I can tell you that if you look back at all of the publications over the last several years of health systems that are, having issues from a cyber perspective, or their systems are being hijacked or taken over, many of those still have on-prem servers with operating systems that simply have not been updated. They're more vulnerable. We tell people to, run, do not walk to the cloud, where you have decentralized data models, you have data that is encrypted in transit and at rest, that there are a number of best practices from a security perspective, even in HIPAA compliant environments, that can protect you, where even if you did have a breach, that breach could be limited and restricted not to an entire longitudinal record, but just to a piece or a fragment that would be very difficult to put a full picture together. So there are a lot of different standards and protections, but ultimately looking for organizations with high trust certification that have had to get very serious about their documentation and proven practices for security and compliance are particularly important.
Totally. Thank you so much, Kristen. So the next question I have for you today is, what is your perspective around governance or risk management regarding third-party apps and their requests for and sending in of data?
Absolutely. So for a third-party application is an organization that a patient can select in order to go collect and aggregate their healthcare data or records. There are, as entities like providers or payers who are subject to information blocking and interoperability rules, there are best practices with app implementation onboarding. In fact, the CARIN Alliance, CARIN, has an app implementation guide best practice that can be accessed and leveraged in order to onboard trusted third-party applications, what to look for, what to track, how to comply with the rules. But it is particularly important that you look at those things, but still comply within the rules of information blocking and interoperability. We are seeing some inconsistencies across the market as we connect into providers and payers alike. And there are definitely still some confusion points in market, but I think HHS, ONC, and CMS have done a really good job with FAQs. But you can also look at those applications that have attested to the CARIN Code of Conduct. It is a publicly available website that you can access, and you can look at the commitments that those applications have made. And remembering that trusted third-party applications are also governed and regulated by the FTC. So there are a lot of different protections in place for third parties, but I would recommend looking at the CARIN app implementation onboarding document.
Thanks for those recommendations and for sharing your perspective on that question. So another audience member is saying, we've seen some failures of initiatives that had a lot of industry excitement initially and then kind of fizzled. Something like PHR. So is digital front door a fad, or is there something to it? What's the bigger need?
Sure. I mean, one, I don't think that, PHRs were excited and then fizzled. I think that there was a really big learning that was achieved. What we learned was that, one, healthcare data was not meant for consumption by the average human being, and data without any type of intelligence or action on top of it that adds value to a consumer's life is just data. Consumers ultimately, believe it or not, when they access their health records, they find it interesting at first, but it's not like they want to go into an application or a website and look at their data all day long. They want it so that they have control of it and so that they can share it with people that can impact their lives in a positive manner. So having the ability to, and just sharing a quick personal story, Be Well was founded because I have a child with an autoimmune condition where the fact that two EMR systems couldn't communicate with one another nearly cost her life. And that was a technology problem, and it was a business problem. And so the world has changed now. And so having control and protection where if, dad living with chronic conditions is incapacitated and in the ED, seeing a doctor he's never seen before, I have his full medical record on my phone and I can say, here's his doctors, his labs, here's all 11 medications that he takes per day. Here's everything you need to know to treat dad safely. Doctors don't come to work trying to create medical errors, but they oftentimes are missing information to do so. So it is a safety and comfort, but having access to that data is only one small part. So from of the experience, what consumers want is the ability to then share that and have the right to be forgotten with anybody in their healthcare journey. And that journey is going to change over time. One thing we know is consistent is change. We change jobs. We change insurance carriers on average every 2.5 years in this country. We change wearables and sensors as technology advances. So that data needs to start becoming persistent and portable to individuals and their families. Digital front doors are simply an expectation. We have individuals who will say, look, I can order a pizza, I can watch it go into the oven, it can come out of the oven, I can watch it get into the delivery driver's car, I can track it all the way to my front door. But I have to pick up the phone to make a doctor's appointment, and it's sometimes not available to me for 12 to 14 weeks out. I don't know what I'm doing then, but I need care now. We have to adapt in order to provide what consumers are expecting, which is a digital framework to access healthcare given choice that meets their needs when, where, and how they want it. And that means that we have to rethink how we deliver healthcare in our ecosystem, and we need to provide choice to consumers if we want to improve health outcomes, align more people to evidence-based medicine, get preventative and get upstream, and ultimately reduce the overall cost and improve quality in our country. I think there's a lot of people focused on that now.
Totally. And I really like something you said, that the digital front door is simply an expectation. It's a good point. So it looks like we have a few minutes left, so I will try to get through one or two more questions. So the next one I have for you is really, why does the system resist organizing around these principles that are so common and familiar to any family or patient consuming healthcare? Why is the resistance persisting, and what are some of those barriers?
Oh, absolutely. I mean, change is hard is the short answer. For the longest time in healthcare, there was a quote, which is, don't change the workflow. You can't go in and sell into a health system if you're going to change the workflow, because those workflows are like conveyor belts, right? When people come in, to a health system or they come into a doctor, they're on a schedule, and it's a very tight and fast schedule to try to get as many people the care they need as fast as they can. But change is difficult when you allow for a system that was designed so that providers can control their schedules. They know how many people they want to see for certain appointment types. They know how much time they need for each one of those appointments. When you go out and digitize that, it can be, one, very scary because doctors no longer have control of the people coming in on the appointment. There's blocks of times, that can be taken, and they want to make sure that they're, kind of the right human and that they're ready for that appointment. I mean, the last thing you want is somebody making an appointment with a surgical neurologist who comes in complaining of migraines, and they say, I don't treat migraines, after waiting 12 weeks for the appointment, right? And so there's a lot of different workflows that need to be digitized, and there's inevitably going to be some errors and mistakes, but you need to learn from those very quickly. But giving up control of existing workflows in order to change and meet the needs of today's digital consumer is scary, and it's hard. And so and quite frankly, it can be very costly. If you don't have an open, secure data platform, if you're not on the cloud, if you haven't thought about integration of your systems together, and you have different siloed, fragmented systems you expect consumers to use, there is an investment from a technology and a human perspective and retraining of an organization, and you need to make sure that you are, quite frankly, still maintaining your revenues and your qualities, or improving those at the same time that you're effectively rebuilding the airplane while you're flying it, in order to meet those consumer experiences. So I would like to say digital transformation has to be a commitment, and it has to be a commitment from the executive team down, and it has to be something that everyone understands is a commitment in order to be successful. But I think the resistance is that it's complicated and it's change, and that's hard, especially when you have to get the entire organization on board with making the change and digging into the complexities and sometimes changing what those workflows need to look like in a way that's uncomfortable for people. And if you're a consensus-based organization, it's even harder, because there's always somebody who's going to say it's not going to work because. So having appropriate governance in place is really important as you move forward into these strategies.
Awesome. Thank you so much. So I want to sneak in one more question before we end today, which is just, can you speak about the harvesting process for the data layers you are using? Is it an automated process of some kind, or do you have coders on staff that are refreshing the data?
Yeah, it's a great question and a complicated one. There are multiple methods for accessing data, right? And so when we, in our client base, we collect data from our customers. We integrate with their core systems by either EMRs and APIs. And we also operate under the patient right of access to go collect data through multiple different pathways. For our customers, we receive data in multiple formats. We still have secure FTP servers with, data files that come in. We don't always get a full, streamed integrated approach, which we would like to work towards across all of our integrations. But I will say in many of our employer clients, we're still getting Excel spreadsheets. So healthcare data transacts in many different formats, many different methods, and many different timing. And what we recommend is always to standardize your data. So however it comes in, bring it into one core mapped environment. We recommend FHIR, creating endpoints, using implementation guides, getting it all into one standardized approach, and building your quality routines around it. Is this, usable data? Do we have goodness of fit? Min-max missings? Is it quality data? Understanding when data may be missing, and being able to put in place as many automation processes as you can to determine whether or not data is complete, data is accurate, that it has quality as it comes in, and that, I like to say, are the trains running and are they running on time? All of that is automation. You will always need coders because healthcare data will always change. If any of you have ever seen the amount of data that comes off, a smart watch and how frequently you can get it, nobody wants to integrate that data directly to an EMR. It's not useful that way because what doctors really need is insights, not just data. So you need that intermediary level where you consume the data, take the pieces of the data that you really need, create the insights, and push them to the core systems. And the only way to do that effectively is to have a core centralized set of data that is in that open secure data architecture. And then your coders are always working on new and different APIs, new and different mappings for data files that you haven't seen before, and building out those quality routines for the new. But there's not enough coders in this country if you were trying to manually do this. And with more and more new entrants, there's a huge competitive landscape for data engineers, and especially those who understand some of the complications and nuances of healthcare data.
Awesome. Thanks so much, Kristen. Unfortunately, that is all the time we have for today. I want to thank Kristen for an excellent presentation and Be Well for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.
Thank you so much, Beckers, for having us, and thank you all for attending.